All right, thank you for joining us for another phlebotomy certification practice test. I am Nurse Eunice and I will be helping you pass your examination. Let's begin. First of all, let's talk about who is a phlebotomist. A phlebotomist is a vital member of the healthcare team, is someone who's specially trained to draw blood from patients for diagnostic testing, transfusions, donations, or research. Their skills ensure that lab results are accurate and that patients remain safe and comfortable during the procedure. Key responsibilities include collecting blood specimens using venipuncture, finger sticks, or heel sticks, verifying patient identity and labeling specimens correctly, maintaining sterile equipment and ensuring infection control, preparing specimens for transport to the laboratory, and providing reassurance and support to nervous or fearful patients. Who or where can phlebotomists work? Phlebotomists have flexible career options in a variety of healthcare settings, including hospitals and urgent care centers, clinical and reference laboratories, physicians' offices and outpatient clinics, mobile phlebotomy units, donation centers such as the Red Cross, research institutions, and home health and insurance examination services. So, how can you become a phlebotomist? You can always start with your local community college. However, Florida Training Academy has partnered with CareerStep, a nationally recognized training provider that offers flexible, affordable, and online phlebotomy technician programs. And best of all, they will partner you with an agency in your facility, in your area, in order for you to get your clinical externship. So that is correct. You can find more information by going to floridacareeracademy.com. It is shown on the screen. After you complete your education, you will have to complete, of course, the clinical requirements because you have to gain real world experience through supervised lab practice or the clinical externships that I was just mentioning. And then you can take and pass, because I know you will, your national certification examination. So it's just not going to be a state certification, it is a national certification. And so certification shows employers that you are qualified, competent, and ready to work. Why choose our program in partnership with CareerStep? Because you can complete the classes at your own pace. It is affordable and they do have payment plans. You're going to receive hands-on training if you're here in the United States. And it also provides career support and resume guidance. Again, that is floridacareeracademy.com. You can also speak to one of our advisors at 877-225-7151. Let's get ready for your practice test. If you can, please go ahead and get pen and paper. And we're going to begin our test as soon as I tell you about our phlebotomy study guide. It is free, you all. You can actually scan the QR codes, or you can go to fltraining.com/phlebotomy. It's also shown on the screen. And that way you can download our study guides and also our practice tests. You have to scroll towards the bottom of the page, but once you get there, you will see the phlebotomy study guide. Question 1. As a phlebotomist, you can display professional behavior in a facility by doing which of the following? A. Talking loudly in the patient's room. B. Following dress code and HIPAA privacy regulations. C. Sharing patient test results with friends outside of work. Or D. Avoiding hand hygiene when pressed for time. And the correct response is B. It is going to be following the dress code and HIPAA privacy regulations. So professional behavior includes following facility protocols, respecting patient privacy, and of course, proper dress, which includes your hair, your nails, your makeup, and those earrings. So ladies, tone it down just a little bit. Question 2. Which statement is correct regarding procedures in reverse isolation areas? Is it A, only patients must wear masks? B, reverse isolation only applies to surgical patients? C, no PPE is needed because these patients are not contagious? Or D, phlebotomists must wear protective equipment to prevent bringing infections into the patient's environment? And you can always pause this. You can go back and review it later. So I'm only going to give you about 3 seconds to enter your answers in the chat before I reveal the answer. So for question 2, the answer is D. That is right. Reverse isolation protects immunocompromised patients. So healthcare workers must wear full PPE to prevent contaminating the sterile environment. You don't want to bring germs into their world, so you put on PPE instead. Question 3. A phlebotomist has not been trained with arterial blood extraction, but he proceeds to do so. The patient ends up with a nerve injury. The phlebotomist has committed which of the following? Is it A, assault, B, defamation, C, fraud, or D, negligence? If you've not been trained to perform a skill and you do so, yes, that's right. It is D, negligence. So negligence is performing a duty that requires training or skill that one doesn't have, and it results in harm to the patient. Question 4. You are obtaining consent for HIV screening. Which of the following must be done? A, obtain informed consent and explain the test and its confidentiality. B, test without the patient knowing for public safety. C, charge the patient a fee first. Or D, make sure the provider's family agrees. All right, so if you're doing a sensitive test such as HIV screening, yeah, you all have it. Great job. It is A. Consent for HIV tests must be informed. That means the patient has to know about it. And voluntary. You can't do it against their will. Ensuring confidentiality is explained. Question 5. Which of the following is not true of PPE in a medical setting as specified by OSHA? Is it A, gloves must be changed between patients? B, gloves must be fluid resistant. C, eye protection is optional regardless of exposure risk. Or D, mask must cover the mouth and nose. Again, this question said which of the following is not true of PPE in medical settings. All right, in 3, 2, and I see those answers in the chat. Keep up the great job, everybody. Yes, it is C. Eye protection is mandatory. It's not optional. If there's a risk of splash or spray of blood or other infectious materials. Question 6. Alcohol-based disinfectant is not recommended in cases of contact with which organisms? Would it be A, hepatitis B virus, B, HIV, C, C. diff, or D, influenza? All right, so which of these organisms can you not use alcohol-based disinfectant or hand sanitizer? Yeah, you all have it. It is C. So alcohol is not effective against C. diff spores. Soap and water hand washing is required. Question 7. Bloodborne pathogens may be transmitted through which of the following exposure modes? Is it A, contact with mucous membranes, non-intact skin, or percutaneous injury? B, sharing food and drinks? C, casual touching or hugging? D, being in the same room? And this one's super easy, so I'm revealing the answer right now. Of course it's A. So bloodborne pathogens like hepatitis B, hepatitis C, and HIV are transmitted via blood contact with mucosal or breaks in the skin or needle stick injuries. That's what we mean by a percutaneous injury. Question 8. Which of the following arteries is a common site for arterial blood extraction and is located in the inguinal canal? Is it A, brachial artery, B, femoral artery, C, radial artery, or D, popliteal artery? All right, revealing the correct response in 3, 2, and Yes, it is B, the femoral artery. So the femoral artery lies in the inguinal region and is commonly accessed for femoral artery puncture. And so you'll usually see that if you work in like cardiovascular units or the cath lab, that's when you will see femoral lines, and that's where we will, of course, your nurse would probably be the one who is obtaining a blood specimen via the femoral route. Question 9. Which of the following describes the correct way of determining an irregular pulse rate? Is it A, count for 15 seconds and multiply by 4? B, use an automated machine? C, count for 10 seconds and multiply by 6? Or D, count for a full 60 seconds? Perfect, team. Yes, it is D. If something is irregular, whether it's the pulse or respirations, you have to count for a full 60 seconds for accuracy. So irregular rhythms or irregular breathing patterns require a full 60-second count. Question 10. Body systems are made up of a few organs that coordinate to perform interrelated functions. One example of a body system is which of the following? Is it A, digestive system, B, red blood cell system, C, neuron system, or D, platelet system? All right. That is right. It is A. The digestive system is an example of body systems comprising of multiple organs that work together for a common purpose. Question 11. Which of the following kinds of blood vessels carry oxygenated blood? Would it be A, veins, B, arteries, C, lymph vessels, or D, capillaries only? Revealing the answer in 3, 2, and that's right, arteries. It's B. Arteries carry oxygenated blood away from the heart to the tissues. Question 12. An expired collection tube causes which of the following problems? Would it be A, loss of vacuum and incomplete draw, B, increased contamination, C, increased RBC count, or D, rapid clot formation? The correct answer is A, loss of vacuum and incomplete draw. So expired tubes often lose their vacuum seal, leading to insufficient specimen collection. Question 13. Which of the following stages of hemostasis is evaluated by bleeding time? Is it A, vascular spasm, B, fibrinolysis, C, platelet plug formation, or D, coagulation cascade? Yeah, after talking all day, try to say some of these medical terms. So, all right, everybody, team, which one is it? Is it A, B, C, or D? And it's C. This may be a new term for a lot of you all. It's platelet plug formation. And here's your rationale. So, bleeding time checks how well the platelets work to stop bleeding. It focuses on the platelet plug formation stage, which is when the platelets stick together to seal a small cut. It would not have been a vascular spasm because that is when the blood vessels tighten to slow blood. It would not have been fibrinolysis, which is when the body breaks down the blood cells when the body breaks down a clot after healing. And it would not have been a coagulation cascade because that talks about the clotting factor process that forms a strong clot. And it's tested by other lab tests, not by bleeding time. Question 14. A phlebotomist should do which of the following before discarding a used needle? Is it A, recap the needle, B, replace it in a puncture-proof sharps container immediately without recapping? Is it C, dispose of it in a regular trash bin? Or is it D, cut with needle and scissors? Okay, of course, none of us are going to do D. Number one, it takes too much time. And number two, like, why would we ever? And so if you chose B, you understand that OSHA guidelines require immediate one-handed disposal into a sharps container without recapping to prevent needle stick injuries. And so if you go back to our channel, I just posted a video showing a nurse drawing blood. I posted that one on yesterday. And so if you just need a quick tutorial on how to perform venipuncture, I think that video is less than 2 minutes. Go ahead and watch it and also share it with your colleagues. Question 15. Which of the following kinds of information is not found on a requisition form? Is it A, the patient's name and date of birth? B, the test to be performed? C, the patient's address and social security number? Or D, the ordering physician's information? And yeah, you have it. It is C. Personal address and social security number are not included on a typical requisition. But what is included? The patient's name, the date of birth, the test to be drawn, and also the physician's information. And in that way, once the nurse or the office staff receives the lab report, the physician can then give the orders. Okay, so if we don't have the physician's information, we won't know which physician to call or which physician actually ordered those labs. 16. How long can a tourniquet be allowed to compress a vein? Is it 2 minutes, 1 minute, 3 minutes, or 30 seconds? Do not think about what you have seen in practice or what you saw at the doctor's office. This is based off of national standards. And that is right, you all. It is B, it is 1 minute. So a tourniquet left on for more than 1 minute can cause hemoconcentration and inaccurate test results. So if it's taking you longer than normal to collect the blood specimen, you would have to release the tourniquet and start that process all over again. Question 17. How can a vein be properly palpated? Is it A, tap the vein with force? B, feel for its pulse and strength with your middle finger? C, stroke the area vigorously after cleaning? Or D, feel for its bounce and resilience with your index finger? All right, and for this one, I see you're torn between B's and D's. But the correct response is going to be D. That's right. You feel for its bounce and resilience. Remember, a vein shouldn't have a pulse. And you don't usually just feel with your middle finger. It would be your index and your middle finger. So gentle palpation with the index finger can detect a spongy, bouncy vein. That's what you want. You don't want a vein that has a pulse because that would not be a vein. That would be an artery, and you can actually cause your patient to bleed severely. Question 18. When both arms have no accessible median cubital veins, which of the following veins can be a second choice? Is it A, the femoral vein, B, the basilic vein, C, the brachial artery, or D, the dorsal veins of the hand? If you chose D, you're absolutely correct. So dorsal hand veins can be used as an alternative when antecubital veins are inaccessible. And sometimes those hand veins may roll, they may move whenever you approach them with the needle. So make sure you anchor it. 19. The angle of the needle for venipuncture should be which of the following? Is it 45 to 60 degrees, 90 degrees, 15 to 30 degrees, or 60 to 90 degrees? All right, 3, 2, and that is right. It is C. So I liken it to a plane that's landing. And when a plane is landing, you don't want it landing too, at a high elevation because that means that it's going to crash. So we need a shallow angle. So 15 to 30 degrees whenever you're inserting your needle, that allows proper venous access with minimum trauma. It also kind of helps to ensure that you don't go through the vein. 20. The ideal time to invert evacuated tubes with additives is which of the following? Is it A, immediately after filling, B, after centrifuge, C, before labeling, or D, once they arrive in the lab? All right, I'll wait for about 3 more answers to come through. And I see them now. So here we go, team. The answer to question 20 is going to be A. So tubes must be inverted gently right after filling to mix the additive properly. 21. Which of the following is the maximal time to centrifuge a coagulation assay specimen after receiving it? And so, what some of you all are not aware of is that some phlebotomists work in the lab. So, yes, you may have to also perform the venipuncture on the patient, but then after that, you have to process the specimen. And so, that's when we start talking about the centrifuge, and you'll learn that more in the phlebotomy course. All right, so would it be within 1 hour, within 2 hours, within 4 hours, or within 24 hours? So you just received a coagulation assay specimen and it needs to be centrifuged. How much time do you have before you need to start that process? It is A, within 1 hour. I'm so proud of you. So coagulation tests require prompt centrifugation to maintain accurate results. And if you stayed with us this long and you haven't pressed like, if you haven't hearted this video, go ahead, help a nurse out and do so. We appreciate our viewers like you, and always thank you for your support. All right, so question 22. You arrive at a patient's room, but she is still sleeping. Which of the following actions is appropriate? A, ask the nurse to draw her blood. B, draw blood without waking her. C, wait outside for an hour. Or D, gently wake her and verify identity. That's right. When those phlebotomists come into those buildings at 4, 5, or 6 a.m., they just can't let you sleep. They have to get their job done. So it's going to be D. We're going to verify the patient identity. We're going to wake them up gently, but we need to get that blood specimen. 23. Why is the median cubital vein preferred for most routine venipunctures? Is it A, because it is closest to the artery? B, because it is large, well anchored, and less painful? C, because it is the most difficult to fill? Or D, because it is very deep? Right, that's right. You have to know the names of the veins. So the median cubital vein is preferred because of B. It is large, well anchored, and less painful. So the rationale, the median cubital vein is stable and superficial. That means it's easier to see. It's on the surface level, making it the safest choice for routine venipunctures. 24. Your patient appears pale, cold, and clammy while you are about to perform venipuncture. Which of the following adverse reactions may develop? Is it A, syncope, B, hypertension, C, fever, or D, nausea only? All right, revealing the answer in 3, 2, and it would be syncope. It's A. Pale, clammy skin indicates a vasovagal reaction that can lead to fainting. That's why our phlebotomists also need to know CPR. All right, you have to know what to do, and first aid. You have to know what to do if a patient's bleeding. You have to know what to do if a patient feels faint. And so take those classes seriously. 25. As a phlebotomist, how can you prevent a hematoma from forming? Is it A, insert the needle slowly at a 90-degree angle? B, apply firm pressure to the site after needle removal? C, do not release the tourniquet? Or D, avoid holding the gauze over the puncture site? That's right. You can help prevent hematomas. But how do you do that? You do that by B. You need to apply firm pressure after you have removed that needle. And that's going to help prevent the blood from leaking into the surrounding area. 26. A patient has ecchymosis at the venipuncture site. What does this mean? Would it be A, excessive bleeding from an artery, B, blood leaking into the collection tube, C, blood clot inside the vein, or D, blood leaking into tissues under the skin? Ecchymosis. All right, revealing the answer in 3, 2, and it is D, blood leaking into tissues under the skin. So ecchymosis is a bruise, but it's a bruise specifically caused by blood leaking into the surrounding tissues. And you'll commonly see this on a patient who maybe is on blood thinners and they're in your facility or your hospital. And after the blood is collected, even the best phlebotomists, just because they bruise easily, you're going to see them and their arms will be ecchymotic. So ecchymosis is a bruise. 27. Which of the following technical errors must commonly lead to hemolysis? It is it A, gently inverting the tube after draw, B, using a too small needle gauge or drawing too quickly, C, labeling the tube properly, or D, cleaning the puncture site with alcohol. Which is a technical error that leads to the breakdown of cells? That's right. You cannot use a needle that's too small. So the answer is B. A small gauge needle or fast draw can cause turbulence, damaging red blood cells, and leading to hemolysis. And so the normal size for an adult for venipuncture is anywhere from 20 to maybe 22. So if you go 23, that's way too small. And if you go to an 18 gauge, that's way too large. And so one's going to cause pain. That 18 gauge is going to cause pain. And the 23 gauge will not allow you to collect your blood specimen. And if it does, the red blood cells may break down in the collection process. 28. Which instruction should be given to a patient preparing for a fasting blood glucose test? Is it A, do not eat or drink anything except for water for 8 to 12 hours? B, eat normally before the test? C, avoid water and food for 24 hours? Or D, drink orange juice an hour before the test? Yep, you have it. It is D. Fasting ensures that glucose levels are not influenced by recent food intake. And what you'll commonly see is an order or a sign that says NPO after midnight, meaning that your patient cannot have anything, any food, or, water, any food or fluids besides water after midnight. So again, it just depends on the test. But for this one, usually they can still have a small sips of water, but nothing else. 29. What is the function of the pulmonary vein? Is it A, carry oxygenated blood from lungs to heart? B, carry deoxygenated blood from the body to lungs? C, carry blood to the liver? Or D, carry blood to the brain? I have a trick for you to remember for the pulmonary vein. The pulmonary vein is one of the only veins that works in reverse. So instead of carrying deoxygenated blood, it would be A. The pulmonary vein carries oxygen-rich blood from the lungs to the heart. So the pulmonary veins are the only vein in adult circulation that carry oxygenated blood. So that is the one outliner. 30. Which specimen requires strict chain of custody documentation? Is it a blood culture, an HIV test, a drug screen, or a glucose test? And remember, if you feel that I'm going too fast, you can pause the video, you can slow it down, and you can always watch it multiple times. All right, so here we go, team. The answer to 30 is going to be C. Drug screens must be tracked precisely to ensure results are valid and legal. Chain of custody refers to the documented and unbroken process of handling, collecting, transferring, storing, and testing a specimen from the moment it is collected until the final result is reported. This protocol ensures that the integrity and identity of the sample are maintained at every stage. 31. Where is the basilic vein located? Is it A, on the thumb side, B, near the center of the arm, C, in the wrist, or D, on the pinky side? So I want you to look at your arm, have your hand or your palm up, and I want you to trace either your thumb side up or your pinky side up. All right, and which one of those veins would be the basilic vein? And if you said D, pinky side, you're absolutely correct. So the basilic vein runs along the medial pinky side and lies near arteries and nerves. 32. What does the term bifurcation mean in phlebotomy? Is it A, a type of blood collection needle, B, the splitting of a vessel into two branches, C, a blood clot, or D, a vein used for venipuncture? All right, I see a few different answers, but for this one, it's going to be B, bifurcation. It's branching. It refers to a blood vessel dividing into two branches, which is important when locating veins or arteries. Remember, at the center of that bifurcation is usually a valve. So if a vein bifurcates, you want to use caution when using that vein for venipuncture because your needle may not advance because of the valve, and or you can cause your patient injury because of the valve. 33. What gauge needle is commonly used for routine venipuncture? Is it 16, 18, 21, or 27? And my fingers are crossed because we just talked about this and I know you wrote your notes. And if you wrote your notes, you know that the answer would have been C. That's right. So I said 20 to 22. So a 21 gauge needle is standard for adult venipuncture. It's large enough for blood to flow, but it minimizes trauma. And your job, once you actually have a job, your other job is to make yourself familiar with the equipment, with the needles, with whatever your facility provides, whether it's going to be a vacutainer or a straight needle or a butterfly collection set. You have to know how to work the equipment before you start your venipuncture process on your patients. 34. What does CLSI stand for? Is it A, Clinical Laboratory Standards Institute? Is it B, Certified Lab Science Instructor? Is it C, Clinical Licensing Standards Institute? Or is it D, Clinical Lab Safety Investigations? CLSI stands for A. All right. And sorry, the answer is A. And so it stands for the Clinical Laboratory Standards Institute. And so they are the agency that sets the guidelines for lab and phlebotomy practices. 35. A phlebotomist needs to draw blood from a patient who has an IV in the left arm. What should the phlebotomist do? A, draw blood from above the IV site. D, use the same arm below the IV site without notifying the nurse. C, ask the nurse to turn off the IV and draw above the site. Or D, use the right arm or another site if available. That's right. So when you go into those rooms and you see fluids infusing, you need to pause for a moment. You need to know what's infusing. And you also need to see if there are other options as far as where you could perform venipuncture. So the answer is going to be D, because drawing from the same arm that has fluid or medications infusing can lead to sample contamination. So whenever possible, you want to use an alternative site, and or you'll need to be notifying that nurse so that she can temporarily pause that infusion. Otherwise, let's say that they have normal saline infusing and you draw from the same arm where the saline is infusing, the lab result would show that the saline level is high, and it's not a true, or it's not an accurate specimen. It was contaminated by the IV fluids. 36. The prefix phlebo refers to, is it artery, nerve, vein, or blood cell? This one's easy. How can you be a phlebotomist and not break down the term? The prefix phlebo means, yes, you have it. It is C, vein. So in phlebotomy, phlebo means vein, but phlebotomy, that term means the cutting into a vein. And so cutting sounds so drastic and barbaric, and that's because it is. Back in, older times, or when they first started trying to modernize medicine, the way that they received blood samples was by actually cutting people. It was called bloodletting. And so that's how they collected blood specimens prior to modern day medicine. 37, true or false? The basilic vein is typically the first choice for venipuncture. I told you to start writing down your veins. All right, so I had you have your palm resting upward. I told you to trace your pinky. That's where your basilic vein would have been. Would that be the first choice for venipuncture? False, absolutely not. The median cubital vein is usually the first choice. The basilic vein is near arteries or nerves, and it makes it more risky. You can sometimes perform venipuncture there, but it's not the first choice. 38, to minimize contamination during blood collection, blood culture collection, the phlebotomist should do which of the following? A, collect the specimen after the other tubes. B, clean the site with alcohol only. D, avoid touching the site after antisepsis. Or D, collect from an existing IV line. We're talking about minimizing contamination with blood cultures. The answer is C. And so usually for a blood culture, we're not using alcohol, we're using ChloraPrep. And so once you have cleansed that area, touching the cleansed site can introduce skin bacteria into the blood culture bottle, leading to false positives. That's also why sometimes you'll have an order for 2 sets of blood cultures from 2 different sites, 10 to 15 minutes apart. And that way we can determine whether it was operator or phlebotomy error, or if this patient literally has this bacteria growing. So if both cultures show the same bacteria, we know that's in that patient's bloodstream. But if one culture shows a bacteria that the second tube doesn't, that means that more than likely our phlebotomist contaminated that specimen. 39. What is an appropriate response if a patient asks what tests are being drawn? Is it A, I don't know, B, ask your nurse or doctor, C, let me show you your chart, or D, I can tell you which tests are ordered? Yeah, it is D. So phlebotomists can review the lab requisition form and inform the patient of the test being collected, but they should not interpret or explain the reason behind the test. That falls outside their scope of practice, at which point they will refer the patient back to their provider. But you can tell them what tests are ordered. You just can't tell them the reason why they are ordered. 40. What does hemoconcentration refer to? Is it A, a decrease in red blood cells, B, the clumping of platelets, C, a decrease in plasma volume, or D, an infection in the bloodstream? What does hemoconcentration refer to? And we're going to break down those words. Hemo referring to red blood cells or blood, concentration. All right, and so if you chose C, you are correct. And so hemoconcentration occurs when the fluid leaves the veins. So we don't have enough fluid. That means that we have more of the blood components and it is concentrated. This often happens due to prolonged tourniquet use. That's why they only want that tourniquet on for 1 minute to avoid or to prevent hemoconcentration. 41. What is the primary function of plasma in the blood? Is it A, transport nutrients, hormones, and waste products? B, help form blood clots? C, carry oxygen to tissues? Or D, fight infections? You have to know about the components of blood and what their functions are. And plasma is A. So plasma is the liquid portion of the blood. It makes up about 55% of the total blood volume, and it transports nutrients, hormones, proteins, and waste throughout the body. 42, true or false? Sclerosis refers to the hardening of the vein wall. True or false? It is true. Sclerosed veins are hardened or scarred, making them difficult or impossible to draw from. And some medications can cause the veins to sclerose. And if a person has a habit let's say they're using IV medications illegally, that can also cause hardening or the scarring of the veins. 43. Lumen is best described as which of the following? A, the outer wall of a vein. B, a type of antiseptic. C, the hollow inside of a needle or vessel. D, the clotting factor in plasma. Great job. It is C. Lumen refers to the hollow the hollow space inside a tube-like structure, such as a vein or a needle. 44. Under what circumstances is it acceptable to draw blood from a foot or ankle vein? Is it A, when the arm veins are difficult to locate? B, only with a physician's written order? C, anytime the patient prefers it? Or D, when drawing a fasting glucose test? All right, revealing the answer in 3, 2, and the answer to question 44 is B. So hand and ankle veins carry a higher risk of complications such as thrombosis. They should only be used with a physician's approval, especially in patients with diabetes or circulatory issues. 45. What is the purpose of the bevel on a needle? A, it prevents clots. B, it increases pain. C, it aids in vein penetration. Or D, it stops bleeding. You all are so smart. I hope you are as proud of yourselves as I am of you, because we understand the bevel of the needle is the sharp part. It is C. The bevel edge helps the needle enter the skin more smoothly. So every time I'm teaching, especially with those butterfly collection devices, you're always going to hear me say, wings up, bevel up, wings up, bevel up. And so, yes, the bevel should be up. What is the antecubital fossa? Is it A, the inner bend of the elbow, B, a muscle near the wrist, C, the outer bend of the elbow, or D, a bone in the forearm? The antecubital fossa. A is the right answer. The antecubital fossa is the area inside the elbow where common veins for venipuncture are located. 47. The term patency refers to A, how thick the blood is, B, the hardness of the vein, C, the strength of the pulsation, or D, the openness or unobstructed state of the vein. Revealing the answer in 3, 2, and that is correct. It is D. A patent vein is open and has a good blood flow. That is the goal. You want to have a patent vein, which is necessary for successful venipuncture. 48. How long should pressure be applied to the venipuncture site after drawing blood? Is it 5 seconds, 30 seconds, 50 seconds, or until the bleeding has been controlled? Can't trick one of you. You understand that the correct answer is D, because pressure should be applied until to the site until the bleeding has completely stopped. This can take 1 to 3 minutes. Remember, some of your patients are going to be on blood thinners. Even aspirin can be considered a blood thinner because it prevents the blood from clotting. So failure to do so increases the risk of hematoma, bruising, or continued bleeding, especially with patients on blood thinners. 49. Which of the following conditions can increase a patient's risk of prolonged bleeding after venipuncture? Would it be A, liver disease and low platelet count, B, hypertension, asthma, and diabetes, C, arthritis, anemia, and high cholesterol, or D, obesity, dehydration, and anemia? Excuse me. The answer to 49 is A. So liver disease affects production of clotting factors and a low platelet count or thrombocytopenia, which impairs the blood's ability to form clots. Both conditions significantly increase the risk of prolonged bleeding after venipuncture. Question 50. What is the first action a phlebotomist should take immediately after experiencing a needle stick injury? Is it A, finish the blood draw before reporting the incident? B, wash the area with soap and water and then report it to a supervisor? C, apply a bandage and continue working? Or D, ignore it if there's no visible blood? It is going to be B. The proper first response to a needle stick injury is to thoroughly wash the area with soap and water to reduce the risk of infection, and then the phlebotomist must immediately report the incident to the supervisor to initiate post-exposure protocols, including medical evaluation and documentation. You all, I am so proud of you, and as a reminder, you can either scan a QR code or you can go to fltraining.com/phlebotomy so that you can download your phlebotomy study guide and also your practice test. Remember that when you get to the site, you have to go all the way down to the bottom. We have numerous guides and, different tools that's going to help you be successful. And so I appreciate you all. If you have not done so, write down this website. It is floridacareeracademy.com. And that way you can speak to an advisor and you can find out more information about phlebotomy certification. And every Tuesday at 9 p.m. It is Night Shift with Nurse Eunice. Look, whether you're a phlebotomist, a CNA, a nurse, a doctor, it does not matter. I am online. I am answering your questions. It does not have to be related to the test. Some of you all just need someone experienced that you can talk to. Don't ask me any questions about biology. And so I look forward to seeing you on my YouTube channels Tuesdays at 9 p.m. Eastern Standard Time. And if you haven't done so, please comment, like, share, and subscribe. We are so close to having 1 million subscribers. And I know that we can do it with family, friends, and viewers like you. So everybody have a wonderful day. I will see you on Tuesday. Bye.